So, hello and welcome to Psych Talks 2.2, Season 2, where we believe in listening, learning, and empowering. Today's episode is all about thyroid, empowering, and thyroid wellness because this theme is based on World Thyroid Day. And our special guest today is a homeopathic physician and a psychologist with 8 years of clinical expertise. And she has a special interest in holistic healthcare, thyroid wellness, and psychological well being. She believes in interdisciplinary approaches to health and behavioral sciences. So, we warmly welcome you, Dr. A.N.Nilamangai. Thank you for accepting the invite.
Thank you. Thank you so much.
So,
Thank you. Thank you so much, Dr. Shia.
yeah, it's
Yeah.
my pleasure.
Let's start.
Yeah. So moving on, my first question would be, how
So,
different is
yeah.
time for common in common terms? Like we all know, thyroid is a disorder where we see cases of hypothyroidism and hyperthyroidism, and we have a clear picture of what symptoms it beholds. But can you explain us how thyroid affects different populations?
Yeah.
Let's say in kids, how it is presented in men and in elderly.
Mm. Okay. So, for starters, let's start with the basic thing about thyroid. Thyroid is an hormone producing gland which is responsible for overall function of the body and metabolism. So basically, it has all of its function in all the organs of the body. So in terms of kids, let's come to the kids first. In children, it is extremely important for its brain development, overall growth, and learning abilities and pubertical changes. If we see in children, thyroid disabilities or imbalances may present itself as poor growth, developmental delays.
Sorry for interruption. Your camera is again.
I'm sorry,
Your camera is still. We already got a comment as well
getting
that your
stuck.
camera is. Yeah, your camera is stuck. So can you please rejoin? It will be a great pleasure for us if you
Okay.
take some effort to rejoin.
Yeah, 1 second.
Thank you.
Yes, yes, I'll do. Can you hear me now?
Yeah, we. I can hear. Yeah,
Yeah, I'm back. Okay,
thank you once again. So
no
please
problem.
continue.
Yeah, so as I was saying before, it is very, very important in growth of the children, developmental delays, speech abilities, and as well as fatigue and pubertical changes. Usually, in pediatric cases, generally in upcoming population, we generally see numerous amount of speech delays, and pediatric evaluation definitely and always includes thyroid profile in it. This is very undiagnosed and undertalked gland of our body. Usually, we do not directly search for thyroid. We generally go into other blood tests. But in children specifically, it is very important to address thyroid and rule out any hyper or hypothyroidism, since it is very important for their growth levels in all aspects of the body. And another part, we can also say something. There's some condition called congenital hypothyroidism. So in that, the thyroid levels are low from birth, and this is essential because that is why it is very essential that newborn blood screening test is very important, so that we can rule out major neurological damage in the future for children age group specifically. So that is why thyroid levels are very, very important for their growth.
Going to men, how different is thyroid? The clinical picture.
Yeah, in men, yeah. So in men, again, it is under talked because we don't usually go regarding thyroid imbalances. We don't even look thyroid imbalances in men, we don't even think about it because it's more commonly seen in children as well as female patients. But in men, it may present as fatigue, weight gain, hair fall, or fertility issues, reduced stamina. And usually, we get these kind of cases when, especially in infertility patients. When we deal with male infertility, we definitely need to look for thyroid levels as well as the other aspects of the fertility tests because this is very undertalked gland of a body. Men are often misdiagnosed. Instead of thyroid, they are misdiagnosed as anything, any other condition.
So, can you shed some light about thyroid in elderly?
Yeah, elderly is usually the age groups between, starting from 50s to like from menopause to the remaining aspects of life. Elderly patients are not found typical symptoms of either hypo or hyper. It's not the classical textbook symptoms of thyroid imbalances. Usually, they present as the age-related complaints such as memory loss, dementia, or depression, mood swings, or any constipation. It's generally known fact that the more age factor comes, slowly the functioning of the body slowly start to deteriorate. So that misdiagnosis happen in elderly patients. So that kind of misinterpret as thyroid imbalances. Once we check, we can rule out thyroid imbalances. And again, another research recently has developed that post 60 from especially TSH levels, if it is in subclinical state, that is from 5 to 10, if the TSH level is there in elderly patients, usually doctors do not immediately give them or administer thyroid medicines because it is very commonly seen in elderly patients of that age group. If it is symptomatic, if it is troubling their day to day life, then they may start thyroid medications accordingly.
Okay, so now going to the symptoms of hypothyroidism. Let's begin with hypothyroidism. That has created so much hype nowadays. For every female, when
Yeah,
we take up a case, they present with weight
yeah,
gain, they present with PCOS, and all menstrual irregularities come alongside.
yeah,
So the
yeah,
much hyped symptom of hypothyroidism is
yeah.
overweight or being having weight gain. So how much exactly weight gain do we have in case of
Yeah.
thyroid?
See, usually thyroid due to thyroid imbalances or in case of hypothyroidism, weight gain is usually 3 to 5 kgs extra. All the other remaining weight gains are due to improper lifestyle, chronic stress, insulin resistance, or irregular eating habits and poor sleep issues. So usually it is only about 3 to 5 kgs of weight gain due to thyroid imbalance. But other than that, that doesn't mean that if you take a thyroid medicine, automatically your weight loss will happen. It is not like a weight loss machine program. But accordingly, along with thyroid medicines, if you start to address your lifestyle issues, your sleep issues, as well as your irregular eating habits, that's become a biggest debate right now for this generation. Since we have a machine life, irregular eating habits and sleep issues are a big major setback for everyone. So that really happens and affects your thyroid imbalances. That may lead to your weight gain. Psychological, if you see, hypothyroidism basically means lesser metabolism. So lesser metabolism in the sense you will tend to have mood swings a lot. If you're feeling low or if you're feeling depressed over a period of time, some people might have emotional eating as a psychological effect. That may lead to overweight. So this is like a vicious cycle. If we can correctly diagnose what is causing and what is causing the weight gain specifically, if it is either due to thyroid or any other hormonal issues or any other psychological issues, it is very easy to diagnose and treat it.
But what the patients do is they don't correct their lifestyle and they blame thyroid. They come with a huge sum of weight gain and they blame thyroid medicines for all the weight they have put on. So now moving on.
Even if you argue with them regarding the sleep, sorry to interrupt, even if you argue with them regarding the sleep, sleep is the biggest problem here. If you go and every one of them have tabs, and everyone is in a digital era, so no one can, at least you can ask them to sleep around 10, 11ish. That's the biggest thing we can bring the change. Otherwise everyone is around midnight, 1, 2 o'clock. So obviously the hormones will get imbalanced, especially for women, because ovulation tends to happen, regularize mostly around the midnight time. So that really affects, and again the vicious cycle happens.
Right. So, how frequently should thyroid tests be done to diagnose any of the thyroid issue?
Okay. So when a person is coming for thyroid imbalance and is diagnosed with either hyper or hypothyroidism, according to the medicines are given. Once the medicine dosages are being changed, it should be monitored every 6 to 12 weeks to see if it is reducing or increasing according to the diagnostic point of view. After it stabilizes, the blood test can be done every 6 to 12 months is more than enough. But in pregnancy, it is always required. The TSH, especially thyroid profile, will be monitored frequently to evaluate the brain growth of the fetus.
Your
And
voice is.
again, another one thing, one point to be added is usually,
Can you please come
can you hear
again?
me now? Can you hear me now?
Yeah, yeah, absolutely clear.
Yeah, yeah. Sorry, again and again I'm interrupting. Yeah,
Yeah. So, how frequently should thyroid tests be done to rule out
yeah.
thyroid hypo or hyper?
Yeah, so again, I'll repeat it. So, if a patient is under hypothyroid treatment, if the recent dosage has been done, you have to monitor them for closely for 6 to 12 weeks after the dosage changed medicine. And post, if it has become stable, you can just repeat the thyroid tests every 6 to 12 months. That's more than enough. You don't need to repeat it every frequently, because it may confuse the results, and it may confuse the diagnostic point of view as well. So always mandatory. It is every 6 months is actually essential for any thyroid patient. And again, one point to be added is only if it is clinically interrupted. Again, in between, if they present any new symptoms or regression of any new old symptoms, then yes, you can again repeat the thyroid and see if there's any change necessary done in the dosage part.
So, what is the role of diet in thyroid cases? Because when we come across patients of hypothyroidism or mostly hypothyroidism, they have a list like these are the goitrogens, and they believe that avoiding goitrogens itself will help them come out of thyroid. So, can you please break the myth out of
Yeah.
it?
See, there's a big myth that cauliflower, cabbage, and broccoli, that these are goitrogens, and these will stop the production of, or it will increase the production of thyroid hormones. Is basically a myth, because see, any food when consumed in excessive form is a poison to a body, regardless of particularly this goitrogenic topic. Any food in that matter is poisonous to our body. But in case of this thyroid myth, we can actually assume that goitrogens, when uncooked and raw, when it is consumed in large quantities, will definitely affect the thyroid hormone synthesis. But only if we cook these kind of foods, the enzymes will actually denaturalize and you can safely have them. So that's one point of goitrogens. Another point, if I can add upon, is iodine. They have a biggest misinterpretation of iodine. Iodine is the biggest part in thyroid, because there's a big debate whether iodized salt is safe or not, pink salt is safe or not, or the normal salt is safe or not. See, iodized salt is something like It's a double-edged sword. If you excessively consume, it's a problem. If you consume it less, it's a problem. See, iodine is very essential for thyroid synthesis. Basically, it helps to produce T3 and T4, which are the major hormones produced by thyroid hormones. I mean thyroid gland. So, iodine deficiency, if less consumed, may lead to the actual symptoms of thyroid, which is enlargement of thyroid gland or hypothyroid symptoms like fatigue, hair loss, weight gain, poor concentration. You'll always feel tired. Developmental delays you can see in children. So, all depends upon the area which they live and the intake. It's very, very important. So, iodine is a double-edged sword. So that is why we should always be careful of what especially that's what we do in homeopathy. We generally start to take the whole history of what they do, what they eat, and how much they eat, and what type of food they eat. So that adds to how much of iodine they take per day, or the amount of zinc they take, or the amount of iron and other vitamin rich foods they take. So that may rule out the iodine deficiency thyroid related issues. So in that way, diet is very important.
So coming to the point of self-diagnosis, people usually come to the clinic. They say, "I am having tiredness, so I may have thyroid." They self-diagnose themselves when they look in
Hmm.
Google or any search engine or any other website. So how can a fatigue be
Yeah,
differentiated in case of thyroid, in case of anemia, and in case of vitamins deficiency? Any vitamin deficiency or specifically vitamin B12 deficiency?
yeah,
What is the difference there?
yeah. So starting with the point, yes, everyone has become a Google doctor right now. So it's pretty much difficult to, we actually doctors nowadays have started to take classes, after which we can start the consultation. That's how it is going on nowadays. Explained by Google. So everything is not true in Google is what I should say. You can always and you should consult your doctor before coming to a conclusion. Um, you can hear me, Arshia?
Yeah, you are clear.
You can hear me? Yeah. So as I was saying, yeah, you are. So coming back to the fatigue topic, yes, there's a particular differentiation between thyroid fatigue, anemic fatigue, as well as the other vitamin B12 or any other vitamin deficiencies, particularly B12. Why? We'll come back to it later. First, thyroid fatigue. Yeah, again, the similar symptoms of fatigue will be, sluggishness, weight gain. You'll feel bloated all the time. You'll feel heavy all the time. So you'll feel you feel tired even after doing a slight work. Dry skin will happen. Constipations. Overall metabolism will go down. But in terms of anemic problems will have a different set of patterns like breathlessness. You cannot do a normal day to day work if you're severely anemic. You'll have dizziness, paleness, again, constipation issues, and exercise intolerance. You cannot do your normal day to day activities, and weakness will be predominantly present. Vitamin B12 deficiencies, why particularly, is vitamin B12 is also one of the commonest deficiencies seen in women as well as in other age group. Vitamin D and B12 are very, very commonly seen. Iron, vitamin B12, and D. So that's why it's a very thin line to differentiate between these three types of fatigues because all of them have similar symptoms. So vitamin B12, coming back to it, it is mostly related to tingling nerve related complaints, numbness, tingling related sensations, burning sensations, along with the again fatigue issues. Even weight gain, gastric issues are more predominantly present in vitamin B12 deficiencies because B12 is more absorbed in stomach. If you have gastric issues, you are having you have the risk of vitamin B12 deficiency is more common inside you, and all this can be ruled out by appropriate diagnostic blood tests. Thyroid means the thyroid tests will be ruled out. Again, accordingly, the B12 and the hemoglobin can be ruled out.
So when is thyroid flare-up considered to be life-threatening or an emergency situation?
Okay. So basically, we know that there are two types of thyroid most commonly known as hypo and hyper. So hypothyroidism is basically low levels of thyroid hormones, and hyper is basically known as higher level of thyroid hormones. To simplify and just say, so emergency conditions in thyroid do happen in even in rare cases, but it does happen. So it immediately needs attention and health care. So in case of hyperthyroidism, we usually call it as thyroid storm. So thyroid storm basically has increased basically hyperthyroidism. So everything is high. Heart rate is high. Your ventilation, hyperventilation, that is breathlessness is there. Difficulty in swallowing is there. Sudden neck swelling is always there. And because of increased heart rate, we have increased pressure in the cardiac muscle. High output failure also can be present. Vomiting and extreme agitation. So if these things happen, we along with the blood tests, if the thyroid levels are extremely high, yes, it is an emergency condition. You have to get immediately evaluated by yourself. And coming back to hypo, that is the thyroid levels are low, we call it as myxedema coma. We That's because of again the opposite of hyperthyroidism. The heart rate will go down. You'll start to hypoventilate. That is, breathing rate will go down. Generalized non-pitting edema will be seen all throughout the body, and you have mental status will also be altered. Your conscious level will be altered, leading to a coma state. So that is also considered as an emergency situation, and you have to properly get evaluated. And again, one point to be added, myxedema is nothing but the water fluid retention which we see commonly in hypothyroidism patients. That's because of the water salt retention and mucopolysaccharides, which we see in here in face as well as on the legs. So most commonly we see we misinterpret because of lack of proper sleep. The eye bags, the lower eye bags will be swollen. So those cases, yes, myxedema does happen. If it is going in an extreme manner, it does lead to myxedema coma.
So, as per the symptoms, as we have explained now, swelling of neck is a point of concern, and we need to take it as like something which is important, and we should not neglect it.
Mm.
So, what does it indicate? Does it indicate malignancy? And in case of neck swelling, what should a person do? Should they go for an ultrasound, or should they just go with the blood tests?
Okay. So any neck swelling is a thing to be evaluated, not only regardless of thyroid. Any neck swelling, sudden neck swelling, or abnormal neck swelling with pain, or anything related to neck swelling, sudden appearance is to be evaluated. Coming back to thyroid aspect, about 90 to 95% of thyroid enlargement cases are mostly benign, that is non-malignant. It is never like every neck swelling related to thyroid is considered malignant or cancer. See, we tend to palpate it. Along with it, we also see if there's any cervical lymphadenopathies present, along with the other symptoms of thyroid imbalances, either hypo or hypo. Along after that, if we feel we need to get evaluated, we tend to go to CT and MRI for clear evaluation. And again, needle aspiration is required if necessary, or we can do stages of thyroid nodule imaging stages. So accordingly, if that can actually clarify us whether it is going into a benign or it is progressing into a metastatic stages.
Your camera has stopped, but I can still hear you. Maybe there's a mismatch in the speed of audio and video.
You want me to
No, no,
glitch?
no. You can remain there. I'll add you.
Can you see me now,
Remove
or should I
and,
come back?
no, no. I'll remove and add you once again.
Sure,
Yeah.
sure.
Now it appears to be clear. Okay.
You
So
can hear me now? I mean,
yeah, 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 absolutely clear.
yeah.
So after moving from neck swelling, some people they are having chronic hypothyroidism, and sometimes they end up in cases of Hashimoto's. They don't know what is happening to them. They take their thyroid tablets regularly without fail, and after a few years they land up in chronic hypothyroidism, and sometimes it ends up as an autoimmune case. So please, can you please shed some light on what is Hashimoto's thyroiditis?
Hmm. Okay. Hashimoto is like it has become a common word. So everyone is like, if I get a hypothyroidism, if they have that concern because of the upcoming digital era and informations, they tend to realize, they tend to panic whether if they have any Hashimoto's. Hashimoto is basically an autoimmune condition. In the sense, to put it in a simpler word form, the body recognizes thyroid gland as a foreign substance and it tends to attack its own cells. So that is what is an autoimmune condition is about. So usually Hashimoto, what happens is, initially if you see the blood test format, the TSH levels will be normal. The later on stages, it will tend to aggravate. Actually, the it will go into hyperthyroidism initially, then it will common and it will go down and just stabilize into a permanent hypothyroidism. So since it is an autoimmune attack, yes, it is not fundamentally a disease of the thyroid gland itself. It is a generalized cellular issue of our body. So usually we tend to diagnose it along with thyroid hormones T3, T4, plus anti-thyroid antibodies TPO and anti-TG. You're able to hear me, Ashya? I can't hear you. Um, can you hear me now?
Yeah, yeah,
Hello?
yeah. I
Yeah,
can
yeah, I
hear.
can.
Yeah, this I think there's a technical issue here. That's why we had to rejoin a lot of times. We are very
Yeah,
apologetic to our viewers. So, Dr. Nila, my question
yeah,
again. Coming to lifestyle issues, what is the best exercise for thyroid cases?
yeah. So we can split that into two. We can just say we can split it as hypo and hyperthyroidism. So what we have seen is hypo means it is all lesser metabolic. Everything is going down. So metabolism is going down. So more fatigue will be there. So in especially in hypothyroidism cases, we can just say that accordingly we can start step by step. You can start the exercise levels. For example, you cannot rush into high level intensity workouts or cardio workouts because underlying overlying fatigue already will be present. If you overdo or push your body to a level intensity workout, you're stressing up, your cortisol will rise. Again, it will pressurize your thyroid gland. But in hyperthyroidism cases, it's opposite. Since everything is high, your heart rate is high, so everything, the metabolic rate is high, you have to slow down your exercise. Hello?
Yeah, my video was not clear, so
Okay, okay, okay. You're fine now? I mean, you can hear?
yeah, yeah. Please continue.
Yeah. Yeah, so as I was saying, in hyperthyroidism, it's the contradictory part. Everything is higher. So heart rate is higher. So higher pressure on the cardiac output and heart as well. So we have to be very careful in not indulging into a very strenuous workouts. It is advisable you start with the basic workouts like walking. Walking is very safe for hyperthyroidic thyroidism patients.
So, as you have already mentioned, after getting input from Google, they patients actually they self-diagnose and they say selenium is important for us. They say Brazil nuts are important for us. So, can you please shed some light upon the supplements used in thyroid cases?
See, coming back to the previous, the talked conversed point, most commonly we see selenium, iodine, zinc comes in, iron comes in. So these are the common supplements which we see in thyroid patients. So what they do is usually without proper consultation, nowadays people are very happily they are into multivitamin tablets. So that point will they think that all the multivitamins, they have all the vitamins and minerals covered, so they're safe. So it doesn't. They don't have the distinct differentiation between what to take and not to take. So let me explain. For selenium is very highly beneficial for thyroid patients because it is a coenzyme which converts T4 into active T3. So, as you told, the recommended dose, in food source form, Brazil nuts 2 to 3 nuts per day is more than enough. In food source form, more than that, you may not require a special selenium supplement to enhance your thyroid function. Only if it required, if we see definitely if it is due to additional deficiency of a selenium, then accordingly the doctor may prescribe you any supplements if required. And B12 supplements or injections all cannot be self medicated. Always it is better to get yourself evaluated, take a blood test. If it is very low, even the low dosages, accordingly the doctor might prescribe you tablets or injections if it is very severely deficient.
Yeah, I guess we have covered up all the questions which we have received. Let me check once again. Yeah,
Yeah.
so we have almost covered up all the questions. So, one last piece of advice from you for thyroid patients and for general population.
Yeah. So, as we have finally come to the end of the session, I would just like to tell something about the general aspects of thyroid issues. The thyroid gland is again under talked or under discussed talked conversation about this gland is something like whenever you have a severe fatigue or chronic stress related issues, or if you're feeling very tired, you're not able to do your day to day activities, do not neglect it in any form. It can be due to thyroid or it can be due to any other conditions of your body. Especially after COVID pandemic, we should not take anything, any slight symptoms if it is occurring for over a month period of time. For example, if it is a chronic fatigue or weight loss, in case of female, if it is many menstrual irregularities, it doesn't mean that it will regulate by itself. You have to get yourself evaluated and you have to get proper treatment. Because thyroid, in a good manner, if you have early diagnosis with proper medications and lifestyle management, it is very easy to manage thyroid levels very beautifully. And again, another point from psychological point of view, I would like to add is, uh, not every mood swing or not every eating habits are due to psychological or psychiatric conditions. It could be a simple thyroid imbalance, or it could be a simple PCOD issues. If you properly get yourself evaluated through blood tests, it could be easily managed. So every month mood swings or every month emotional eating does not mean that you have something related problem in your mental path. It would be a simple hormonal imbalance. So it's better always to consult your doctor and have yourself evaluated, and it is easily very easy to diagnose and treat yourself.
With this, we have come to the end of session. Today's session was very insightful. Thank you so much, Dr. Nilla, for your precious time and your valuable insights. Our viewers online would have gained a lot of insights and information about thyroid, and many myths are busted in today's episode. So thank you once again, once and all, because I know there were few technical glitches and we had to join and rejoin again and again, so that is a bit frustrating, but again, thank you once again, everyone. With this, yeah, so with
Thank
this,
you.
yeah, yes, yes, my pleasure, Dr. Nella, my pleasure. So with this, we have come to the end of the episode, The Butterfly Effect, Exploring Thyroid Wellness. This is Dr. Ashia here, signing off for Psych Talks 2.0. Stay tuned. Thank you.